And now we will again see one more important thing, that is the non-peritoneal areas which are present in the liver. Okay, so sometimes a short note might be asking only about the non-peritoneal areas, or even for your discussion topic, liver is an important topic for your discussion in practicals. There also they will ask about the non-peritoneal areas of the liver. So liver is a large organ which is actually surrounded by the peritoneum, except the areas like the Bayer area, the groove for the inferior vena cava, the porta hepatis, the fissure for the ligamentum venosum. So these are the major areas which are devoid of peritoneum in case of liver. So Bayer area is an area of the liver which is situated on the posterior surface which is devoid of peritoneum. Okay. So one peculiarity, as already mentioned, it is the Bayer area of the liver, and after the Bayer area of the liver, another peculiarity is the presence of the groove for inferior vena cava. Okay. So posterior surface, there is a Bayer area which is devoid of peritoneum. Another peculiarity, the presence of the groove for the inferior vena cava. Then we can see another ligament, one of the true ligament which is situated on the posterior surface. Do you remember that ligament? True ligament, posterior surface, nothing but the ligamentum venosum. Okay. So Bayer area, groove for inferior vena cava, fissure for the ligamentum venosum, all these things are the peculiarities of the posterior surface. Going to the details of each of these things, first we will see the Bayer area. Okay. So the boundaries of the Bayer area you have to know. So this aspect is the Bayer area which has got upper lower boundary which is formed by the superior and inferior layers of coronary ligament. So once I explained the ligaments of the liver, there I have told coronary ligaments are nothing but false ligaments or peritoneal folds. So it has got two layers, superior and inferior layer, which forms the superior and inferior boundary of the Bayer area. And the apex of this Bayer area is formed by the fusion of the superior and inferior layers of the coronary ligament, which is known as right triangular ligament. So the main boundaries of Bayer area being the superior layer of coronary ligament, the inferior layer of coronary ligament, fusion of superior inferior layers at the right aspect which is known as right triangular ligament, and here the boundary being the groove for the inferior vena cava. Okay. So with this the Bayer area of the liver boundaries are defined. Okay. Then we have another area which is known as the groove for the inferior vena cava, which is on the posterior surface, which is also devoid of peritoneum. Okay.